Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and MediSpa. Welcome to our Facebook Live. This is a different version. As people know by now, every October is obviously Breast Cancer Awareness Month, and we like to do a really nice Facebook Live where we've had different people coming in talking about what they do, patients that come in talking about their experiences, and now with the social distancing and the mask requirements, it's really difficult to do that now, especially when we have patients that are undergoing chemotherapy or even radiation. I don't want to really subject them to any of that. So we're going to try to do it a little bit differently this year. So we're actually going to break up that Facebook Live into segments. And so we're going to have little snippets here. And we'll start showing everybody, through the month of October instead of one solid day of it. So the first segment we're going to kick off, and I'm really pleased and proud to have Dani Wilson with us. She is from Our Clubhouse, which is a really terrific program that really gives a lot of support to cancer patients of all cancer, not only just breast cancer. So I just want to kind of launch it off and introduce Dani. So Dani, welcome once again. You've been with us, the last, at least 2 years, right? This is the third year in a row, correct?
Mm-hmm.
Good. So for any of the listeners that haven't tuned in, or some might just need a refresher course, tell us about Our Clubhouse. Tell us about what you guys do there.
Yeah. So at Our Clubhouse, we serve folks touched by cancer. That's any type of cancer, although the majority of our members have been impacted by breast cancer. So we have so many things. I still have not found a great way to say it succinctly, but I will try. We have clinical counseling in the form of individual counseling and support groups. We offer social activities, exercise and wellness, art classes. We have a very large, thriving family and youth program with a whole bunch of kids that get involved. And we do have a 14,000 square foot building with a kitchen and a wellness studio and art room and all kinds of great stuff in the Strip District. But of course, that building has been closed since March.
Yeah, so, as you know, I mean, Ella and I have always been a big supporter of what you guys do because it's really important. And so as we were talking about before, especially with cancer patients, it's really nice to have that one-on-one and really that kind of intimate, face-to-face support. How has all this affected, and how do you do it now, as with the social distancing and everything else? How has that impacted you guys? And really, how do you take care of that now? What's your protocols?
Well, we've definitely missed seeing everybody face to face and being in the same room as folks. We can't wait to get back to it one day, but we want to do it safely. So for now, everything is virtual. We transitioned absolutely everything we do except oncology massage because we can't touch people through the computer, but we even offer Reiki digitally now, which is amazing. Oh, and every other program and activity that we were doing before, we now offer online, and we've added a couple other programs that we didn't have before. It's been really, really impactful. We have folks that are letting us know that during this time of social isolation, we've heard things like we are their lifeline, we are the social support. We have one of the programs that's new for us is a daily coffee and chat. So for 30 minutes every single day, well, Monday through Friday, we have 1 or 2 staff members on Zoom, and people just pop in. There's no agenda. Sometimes we talk about cancer, sometimes we talk about other things, and it really is that daily connection that folks really kind of need right now.
Are patients able to sort of get into a group chat? I mean, you mentioned that, but as you said, like 1 or 2, but do you have actually like formal, like a Tuesday afternoon at 5 o'clock, we have a, support group, or for, family support? Do you, because you guys sort of offer, I mean, you offered that before. Are you able to do that now?
Yeah, we are still, so our support groups are now virtual. So it's only those support groups for that particular Zoom session. And we are using the Zoom for Healthcare platform. So we have pancreatic and prostate and metastatic breast cancer and multiple myeloma and some of those cancer-specific support groups happening. The daily coffee and chats are at a certain time on our calendar, but it's just more open as far as people that attend and topic that's discussed.
It'd be interesting to see, you know, if are you having more people and more people kind of coming to you virtually?
We
Because
are.
now they can sort of be in the comfort of their own home. They don't have to drive in. So maybe, I don't know, it seems to me that that might help family members, you know, be able to take part a little bit easier. I don't know. Have you seen that?
We have seen that. We've actually seen a 250% increase in the
Oh,
clinical support, the one-on-one individual support that's happening, because there's so much anxiety and fear right now that our membership and our new members, we're still getting 15 to 20 new members every month, are
mhm.
really looking for that individual support. But even beyond that, our social activities and art workshops, we have more folks coming. There are members that had moved away that can now participate.
Yeah.
And you'll appreciate this. We had a woman who attended the breast cancer support group
Mhm.
4 days post-surgery.
Wow, great.
She would not have been able to come in to the
Right.
strip district 4 days post-surgery and get that immediate support. So some of this has been, we will figure out how to keep a lot of these virtual services when we can be back in the building. We want to do both in the future.
Yeah, that was going to be my next question because, you know, we're always talking about, you know, sometimes when we get in any situation that, you know, we go through in life, and we have to alter how we do things and kind of take a step back and redefine what we're doing, how we're doing it. Sometimes it's for the better, and sometimes we learn that things that we wouldn't even have thought of before, we think of now because now we're sort of trying to make things better again, you know, and try to reach out. So it's interesting in this case is that when we do go back, as we're all planning on at some point, not completely back to the way it used to be, but when we get sort of more normalized, there's probably going to be some of these programs that you're going to just keep because they actually work better, right? I mean, you
Oh
know,
yeah,
these people have more access to you now virtually than they
right.
ever did. So
Mhm.
anything else that you guys do that you know you might keep that, you know, instead of going back to it, what any other programs that you might just keep virtual?
Well, I think even some of the programs that will transition back in person, we do want to offer the virtual option. So if somebody is not feeling well and can't come down for a nutrition workshop and
Mhm.
it's kind of stationary in the kitchen, if they can zoom into that, they can still participate, they can still see their friends. And so that would be kind of a hybrid component of what you're talking about, where we will go back in the building, but also allow for that virtual attendance.
Yeah, that's even, I didn't even think about that as well. Have you had to hire anybody like or more staff to sort of handle more virtual
We
calls?
actually are not able to because we are 100% dependent on donations, and a huge chunk of that is special events, and we've had to cancel all of our special events. So unfortunately, we did have a couple layoffs, even though the need is greater and people are asking for more services. We are at the point where we might have to start putting folks on a wait list for the counseling. So we're working really hard. We're reaching out to other people and letting them know, hey, we don't want to turn anybody away, and try to get some more of that funded.
Well, that's good to know too, because then, you know, again, I mean, we're big supporters, but you know, that's something that was, you know, it's good that we're having that conversation so we can kind of try to help out
Yeah.
giving some of that money back or and finding, you know, some people that might want to be able to donate to get those services because they really are important. I have patients that really use your services and it really does help them, especially in that immediate post-op period. Like you said, this lady, you know, this one patient's 4 days out, they don't know what
Mhm.
to expect, and so this can really help them. And you know, there was other things that why I like that Facebook Live is because then they had ideas out, like with Lisa Laurie and some of the clothing and the, you know, that they can buy, and it can kind of help them through some of these immediate post-op treatments and everything else. So, you know, we'll have to try to get, you know, get you guys connected again as well. Who,
Yeah.
so does anybody, are there main programs that donate to you, main companies, or is it again mostly through fundraising and programs that you do that's how you raise your money? Is it, or, you know, corporate donations? You don't have to
There
name anybody, you know, specifically, but
I won't. There are three primary revenue streams for us. One is the special events, which we did have to cancel the rest of last fiscal year's events. We do have a virtual event coming up this month, actually. But for the most part, that line item was completely, it was pretty devastated. And then we have foundations, which have done a lot of emergency funding. And we did get a little bit of that, like our Zoom telehealth. That's an expensive platform, but it's important for us because it's HIPAA compliant. And that was grant funded. But the pivot of the foundation world is to a lot of this frontline work. So some of that we're not receiving. And then our third revenue stream is individuals. And actually the individuals have really stepped up. So that is the only funding stream that hasn't seen a dip since COVID started. So it's really fantastic. People out there know what we're doing and are, you know, dipping into their own pocket to help out. And that's why we didn't miss a day. It's why we're still going. It's because folks making sure, they want to make sure that nobody has to face cancer alone.
And that's incredible. And again, because now you can actually, through all of this, as we were saying before, you can actually reach people, you know, that are still immunocompromised, as I said, with the chemotherapy that they're undergoing, the radiation and all the other treatments, so they can really still have access to you. So tell us how patients or people like me that are providers, how do we get patients to you? And if we want to be able to help fund you and donate to your cause, how do we do that? So if you can kind of walk us through that, I think that'll really help and get people more involved. And so also that I know, number one, so we can support you even more. And number two, you know, patients that I have that might want to be able to do that as well. So can you walk us through that?
I can actually share my screen, which I couldn't do on Facebook Live, although I am not the host. Do you think that you'd be able to make me host? I can tell you how if you're not on Zoom a lot.
I have my fantastic web vendor, Beth, here, do all that.
Got it.
Got it?
Yeah. So I'm going to show you our website. Actually, I'll start with our homepage. So our website is Our Clubhouse. You can see it right here, ourclubhouse.org. And this top screen kind of flashes to different ways you can support us. But most importantly, I'm going to show you this link right here. Says become a member. So membership is free to anybody impacted by cancer. And everything we offer is always free to all members. And there are 3 different forms. So you would just click what you most identify with at the moment. Some folks have had cancer and they're caretaking for somebody. And so it's really just kind of the form that you're most identifying with right now. You would click this link if you are the person with the diagnosis, if you're a loved one, if you are grieving somebody, and it will just take you to that form, which is online. You can fill it out. We do have paper forms we can mail if people aren't comfortable with this. And that's it for becoming a member. Also on the homepage are, well, actually right there on the member page was our phone number. So people can always give us a call and talk to us. Once a membership form is submitted, one of our, either our program director, we have some LPCs and social workers on staff, somebody will give each member a call to kind of talk through how we might be able to help them and what they're looking to do. But also on this webpage, you can go to contribute, and there's information about becoming a volunteer. We are still very heavily volunteer led. We have exercise every day. We have Reiki 4 times a week. Those are all led by volunteers, and our workshops are as well. There's a vacation raffle ticket and different events. The next one we have coming up is virtual. So we do this wine tasting, as you know, because you've supported it, I think since you moved here to Pennsylvania, in the fall. And this year is virtual. The ticket's only $25, and there are 4 sessions. People can come to 1 or all 4, and it's really a wine education session is kind of how we've done that this year.
Oh, I'm looking forward to that.
Yeah. Yeah, I don't actually drink wine, so when I heard it was 4 days, I was like, okay.
That's pretty good. Yeah,
I'm going to learn. I like to learn, so there we go.
Good. And then I see a donate tab on there as well.
Yes. Thank you I neglected that. So there is a donate tab, and there is the form right there. This is one of our families. This is Kara. If you are already a part of our clubhouse, you'll recognize Kara and her sons Hansi and Jesse from our spring appeal a few months ago. But you can just fill in right here and the donation would go through online. There is on the next page, there's a way that you can honor somebody. So that's, or give a gift in support of them, which is really lovely.
Oh, that's fantastic. All right. Well, listen, thank you so much. And again, thank you for being a part of this. It's such a great cause, and you have such a great, just the whole program that you have is phenomenal. And we will continue to support you and sponsor you in any way that we can. And now I know where that tab is. We'll definitely help you out.
Can I just say one more thing?
Sure, absolutely.
Okay, I just want the folks that are listening that are impacted by cancer, it's such a tough and scary time right now. I just want to give another, I'm sure they've heard this, but another word of encouragement that if people are asking you what they can do for you, now's the time to take them up. Now is definitely the time to listen and let people do something for you, whether it's dropping something off on your doorstep or teaching you something about FaceTime or scheduling a weekly phone call, because folks are really feeling the isolation out there. So.
And that's great, because this is a pretty lonely time for a lot of people. So I hear what you're saying, and we will do our best to get that message out as well. So Dani, thank you so much.
Thank you so much. It was nice to see you, and thanks for having us be a part of this again.
And anytime. And so for anybody who would like to get involved or donate, please go to that website, and we'll be coming with another segment shortly as well. And so we'll continue this, and we'll hope to see you soon. And this, I guess, will all be virtually done, and then we'll get back to our Facebook Live in November, where we'll do it live here in the office. So thank you again for joining. And Dani, have a good evening. And we'll see you soon.
Okay, take care.
Okay, bye-bye.